And I have great pleasure now to introduce the student valedictorian to address you all. Dr. Rachel Horan is going to come forward to speak on behalf of the students.
President of the Royal College of Surgeons, President of the Royal College of Physicians, Chancellor of the NUI, Dean, faculty, fellow graduates, friends and family from near and far. I feel truly humbled and honoured to be given the opportunity to speak to you on behalf of my classmates and friends, the class of 2013. First of all, on behalf of the class, I welcome all our families and friends to this most special occasion. Many of you have gone to great lengths to get here, coming from long distances. We are very grateful for that. You have and continue to make huge sacrifices for us. It is fitting that today we should look back with pride on our achievements and also reflect on the challenges, opportunities, and responsibilities that lie ahead. Today is a day of mixed emotions. There's the joy of celebrating this achievement and the contrasting sadness that comes with the unwelcome impending farewell. We must recognize that this is a new beginning. So many here have achieved exceptionally and will be moving on to further training all over the globe. Those remaining in Ireland are yet to know their specific jobs, but I'm sure we will all take on our future positions with enthusiasm and tenacity. I feel so privileged to have been educated in RCSI. The huge spectrum of nationalities, cultures, and beliefs is what makes RCSI so unique. This diversity has enriched our college life, broadened our horizons, and has hugely contributed to who we are today. Where else would you get such a variety of incredible societies and events, such as International Night, Chocolate Ball, International Food Night, ballad sessions, and many more, these often followed by nights in the Swan. This class of 2013 truly is a great group of exceptional people. I wasn't always a member of this year, but I've been embraced and welcomed with such kindness and acceptance. Like all the others here, I've been fortunate enough to meet friends that I know I'll have for the rest of my life. The journey to get to this day has been different for many of us. Some were in the 5-year program, some the 6, and some via graduate entry. But we're joined together in celebrating the same wonderful achievement. And what a journey it has been. We started off learning the not-so-basic basics. I think the anatomy room holds a lot of memories for all of us. Will we ever forget the infamous card signings? Rapid-fire questions about the intricacies of the human body. Too often, I was asked to name the blood supply and innervation of a specific muscle and thought to myself, that's a muscle? Where is it? We've just done the hand, so it must be in the hand. We must acknowledge the debt of gratitude we owe to the cadaveric donors, Irish citizens who generously decided to provide us with the opportunity for immeasurable learning. Needless to say, we've done a lot of exams to get here. Written exams, OSCEs, TOSCEs, TOSBAs, short cases, long cases. And I can sincerely say, we will not miss you. The clinical years provided a new learning experience, and we quickly deduced that the hospital is a very different environment from the relative calm of 123 St. Stephen's Green. The prospect of seeing real-life surgery filled many of us with immense excitement, the sense of privilege when asked to scrub in for the first time. This was soon met with the realization that your contribution would be that of a human retractor for at least 4 hours. Many discovered that the anaesthetist was a good person to engage with while in theatre. They had so much to learn from them, their vast knowledge of physiology, pharmacology, and the best new games for your iPhone. Fourth year brought exposure to new and challenging specialties. Obstetrics and gynecology afforded us with the privilege of witnessing and participating in the advent of new life. We in turn provided entertainment to new mothers with our amateur fumbling with the baby girls and our unbridled terror at the prospect of doing the Mara reflex in their presence. Pediatrics was a rotation to challenge the immune system. Not contracting any airborne illnesses or gastroenteritis was considered an achievement in itself. The psychiatry curriculum managed to perfectly describe the characteristics of a medical student with its definitions of anxiety, depression, paranoia, and OCD. And GP rotation, that gave us a view into the almost mythical concept of a work-life balance. Some essential non-academic lessons have been learned during clinical rotations, and those skills will be imperative for our survival in the next year. Eat when you can, sleep when you can, and always introduce yourself as the insert to establish your novice ranks. Throughout all these rotations and placements, we've received extraordinary teaching, both directly and indirectly. Inevitably, in any speech like this, we have the thank yous. It would be an impossible task to name everyone, but our gratitude to you all is enormous. To those who took time to lecture and tutor us, to those who taught us in clinics, corridors, theatres, tiny offices, and as we scuttled behind you, charging from ward to ward. Above all, we must not overlook the invaluable teaching we have received from the patients we have met along the way. A patient's perspective brings an entirely different dimension to a condition and allows some precious insight into their suffering and ability to cope. No book, text, or lecture could ever compare to the contribution they have made. We also express our gratitude to those who keep RCSI running: the porters, the supportive student services, the administrative staff in the college, and many, many more. To you all we say a sincere thank you. Gurv Mila Mahagriv Galer. Let's now reflect on the road ahead. Many challenges and opportunities lie ahead for us now. We are being put into a position of great privilege, and with that comes huge responsibility. There will be highs and lows, sometimes unwanted experiences, but experience is our best teacher. We will have to choose to embrace these experiences and take from them the lessons that will serve us well in the future. I believe it is important that we should aim to emulate those who showed interest in us and generously gave of their time as we traveled on this incredible journey. We must also remember to engage future medical students and juniors with equal enthusiasm. Over the years, we have worked hard trying to determine the type of doctors we are going to be. As our careers progress, we will continue to discover the kind of doctors we're going to be, not just the area of specialty, but how we want to learn to care for others. In the midst of all this, we must be mindful to care for ourselves and to care for our colleagues. Our personal well-being is imperative for us to be able to care for our patients, while maintaining our compassion and our humanity. I could go on, but I was warned I should be brief, and everyone is hungry. So I will close with a few words that are both enlightening and inspiring. Atul Gawande is a surgeon, associate professor at the Harvard School of Public Health, and a writer for the New Yorker magazine. These are his words. You are joining a special profession. Doctors and scientists, we are all in the survival business, but we are also in the mortality business. Our successes will always be restricted by the limits of knowledge and human capability, by the inevitability of suffering and death. Meaning comes from each of us finding ways to help people and communities make the most of what is known and cope with what is not. Thank you. Slán agus Bannacht.